Gum recession. You have a new technique you're using to treat gum recession that doesn't require the older traditional surgery.
Yeah.
Tell me about it.
So typically we have some patients come in, and we've got two types of patients. Some patients come in and they notice that they have longer teeth and they've got some of that root showing. And some of these patients, they just don't like the way it looks. That's an aesthetic concern for them, and I don't blame them, especially if it's in the front teeth. It's not the most aesthetic thing to have longer teeth. And you've got some patients that whenever they take a sip of cold water or they eat a piece of ice cream, then it just sends them through the roof, and that's sensitivity. So we've got two different types of patients that we typically see to treat this recession. And the old way of treating it, it was pretty brutal. What we ended up in
By the way, and people are doing this today. When you call it the old, it's just old for you, but it's how it's normally done.
It's old for me, but you see patients, I mean, they do this thousands of times all over the country, every single day. So this is a procedure that's still in widespread use, but it's pretty brutal because what they do is they actually cut open the gums. They cut open those gums, and then they actually cut the roof of your mouth to borrow a big chunk of that roof of the mouth, and they place it over that area and then pull the gums over the top and then stitch it all in place.
Okay.
That hurts. That hurts. Patients don't like that at all. That causes some serious, serious pain, both in that area and also the palate. When you've got two places that hurt, that just compounds the problem. So nowadays we're able to do it a lot kinder, a lot more minimally invasive for these patients, and they like it a whole lot more because what this technique is called, it's called the pinhole technique, because instead of cutting away the gums like we used to do, cut them open, we're able to do all that with little pinholes. We make little pinholes around the mouth, and we're able to go through those pinholes and free up the gum, actually loosen up that gum.
So like on the upper, they're like pushed up, you're kind of pulling them down?
Yeah, they're like curtains.
And now they stay down?
They're like drapes or curtains. You're able to actually pull those down, and you're able to pull those down so it covers those roots. And then we place collagen in between the teeth and around those teeth to thicken up the gum and make it stay up nice and high for us. And a lot of times we don't need sutures, and it's a great technique to do for these patients because it's a lot less painful, and these patients are much, much happier with it.
Now, we should mention you're one of the pioneers, you and your father. You published papers on this topic.
Oh, yeah. Yeah, we actually, we just presented at the American Association of Dental Research meeting probably a month and a half ago on this technique because Dr. Chow actually invited us to be
Who's Dr. Chow?
Dr. Chow's the inventor of the technique.
Okay,
He's the inventor of the pinhole technique, and he actually invited us to be part of the study. So we were part of the study, and we actually lectured at this national dental meeting on this technique because the results that we found were so great that we're able to prove that this technique lasts a long time.
So the older way of treating gum recession, which is transplanting tissue from the roof of the mouth and transplanting on the gum recession, that'll be behind us.
That'll be behind us. It's a technique that, I mean, people have been trying to come up with different methods of doing that, and this is basically the latest version of that. So, and this is
Does it keep you busy in the practice? I mean, are there that many people with receding gums?
There are. I mean,
really?
the number just keeps going up as you get older. You get more and more receding gums, and you can see. I mean, a lot of these patients, a lot of it can be from brushing too hard, and they can actually notch out their teeth. And these teeth, they get longer and longer year after year, and eventually it can actually cause tooth loss. It can actually cause it to get so bad that your tooth can start to get loose as a result of this
How soon
loss.
does the cold sensitivity go away, if everything works out right?
If everything works out right, it should be, I mean, very quickly, almost immediately. So
like that day, the next day?
Like that day, the next day.
Drink something cold?
Yeah. Because if you can cover those exposed roots, the exposed roots are the part that are actually sensitive. If you can cover those exposed roots, it takes care of the issue, it takes care of the problem.